Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 262 of the Ask Dr. Angela podcast. Is everyone on spring break? Are your kids on spring break? My daughter's on spring break, and what's interesting about her school is they get like 2 weeks off. That's a long time. And so certainly that kind of wreaks havoc on me and my wife's schedule because, it's just us. We don't really have any family in the immediate area, so we just kind of have to make do for those 2 weeks. One of those weeks we always go on vacation, but that first week is kind of hard. Sometimes Francesca's coming to work with me, in my office. She goes to work with my wife, and then, on the days that we can arrange to be off, everything works out, but it's a little bit of a juggling act. I'm super excited as in counting down the days until next week. We are going on vacation. We always let Francesca choose the destination as it's her spring break. And so this year she has decided that we will return to the beautiful beaches of Cancun. We typically stay in an amazing resort. Our room is always right on the beach, walks right out onto the beach, in fact, and we see a lot of beautiful sunrises, sunsets, and the water there is just amazing. I'm excited to go bike riding in Tulum and just to have some good, authentic Mexican food, immerse herself in the culture. I speak Spanish somewhat, and Francesca's learning it in school, so it's just, it'll be nice to really get away and sort of unplug for a little bit. So today's topic is pretty easy, and it's something that I address every day. It's contraception. Someone asked me, Dr. Angela, what factors do you consider when prescribing birth control for your patients? And that was pretty easy for me to answer. First and foremost, it's what the patient wants. What does the patient want to be on? And if they don't know, or if they have no clue about contraception and, various options, then we just review them all. But I will tell you that in my experience, the number one determining factor of what type of contraception someone is going to use has to do with compliance and the individual's ability to be compliant or following the directions or using the contraception as recommended and prescribed. So certainly if you're not someone that is good at remembering to take a pill every day, the birth control pill probably isn't going to be your best option. I find a lot of times that people will come in having some idea of what they want to be on, whether it's because they have friends that are, using certain things. Sally has an IUD that she loves, or, my girlfriend's on this birth control pill and she loves it. I want to try that. And that's all well and good. The other thing certainly to consider is cost. Some birth control certainly is more expensive than others. So we've got compliance, we've got cost, certainly medical history. If there are certain medical issues that may preclude someone from being on a specific type of birth control, that also has to be taken into consideration. And then you have to kind of determine what that individual's plan is with regards to childbearing. If they're looking to have children within the next 1 or 2 years, maybe something like an IUD isn't going to be the best option for them, since most IUDs stay in place for anywhere from 3, 5, or 10 years. Sometimes people want something that's a little less long acting. So, again, something like Depo-Provera, which can sometimes be a little more long in terms of your ability to reverse its effects on the body and get back to regular cycles. That might not be something that someone who wants to have kids within the next year or two is going to want to have for themselves. So we said medical history, cost, compliance, how user-friendly it is. Certainly if we insert the IUD, then there's nothing else for you to do, but perhaps the NuvaRing isn't going to be ideal for someone that's afraid to touch their vagina, or who doesn't want to put anything in their vagina. That could be a little bit of a problem if you're afraid to touch yourself. Good luck getting that NuvaRing in, right? And then, certainly age. If you're a smoker, that certainly is something else that has to be taken into consideration. Certainly over the age of 35, combination birth control pills and smoking are contraindicated. So, there are a lot of things that come into play. Family planning, as I already mentioned. I think that the other thing to consider is, just lifestyle. If you have someone that has some kind of disability, you're going to want something that's going to be really easy for them to do, something that kind of takes it out of their hands. And in that instance, something like one of the implantables, Nexplanon or Implanon or Depo-Provera might be a good option. Certainly, if you're also looking for things to get rid of a period, continuous OCPs, Depo-Provera, and IUD, those are all things that are commonly associated with that benefit. So I think that the biggest thing is not so much things that I consider, but just mainly listening to the patient and finding out exactly what their needs are, what their wants are, what's important to them with regards to contraception. Certainly the other thing to review is effectiveness. Not all contraceptive methods are as effective as others. So that's something else to consider. But the other thing, regardless of what you decide, that I always, always, always emphasize is just making sure that you are practicing safe sex. IUDs, birth control pills, NuvaRings, tubal ligations, none of those things protect against STIs. Condoms do. Barrier protection does. So hopefully that has given you some insight and hopefully will give you some food for thought if and when you are considering your options for contraception. Thank you so much for tuning in to this episode. As always, I appreciate your following and listening. If you happen to have a topic that you want addressed or you have a question that you want to ask, you know how to reach me, www.askdrangela.com. That's AskDrAngela. You can also hit me up on any of my social media venues. I'm on Twitter, I'm on Instagram, I am also on Facebook. In closing, I want to leave you with this thought. And this again comes from my Life's Little Instruction book. I love this book. But anyway, one of the suggestions, it's number 387, says, wear expensive shoes, belts, and ties, but buy them on sale. That actually is probably a page out of my wife's book because she's like the world's best shopper. Anyway, until next time, look better, feel better, be better. Can't wait to reconnect on episode 263 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.